Let's imagine a very common situation. You are facing a health problem such as high blood pressure, anxiety, or even a headache. You go to the doctor, receive a prescription, and start taking the prescribed medications. After all, taking care of your health is essential, right? But what many people don't know is that although these medications are important for treating these conditions, they can have side effects that directly affect your sex life, especially when it comes to erections. Erection is a complex process that depends on perfect coordination between the brain, nerves, blood vessels, and muscles. When everything works well, you have a firm, healthy erection. However, the use of certain medications can disrupt this balance, resulting in difficulties you may not even imagine are caused by the medication you are taking. Now think about it. You are doing everything right, following your doctor's instructions, taking care of your health, but you still face problems during the relationship. This can be quite frustrating, can't it? And the worst thing is that often you don't even know why. It may seem like the problem is psychological or that something is not right with you, but in fact, it could just be a side effect of the medication. This type of situation can cause a lot of anxiety and even affect your self-esteem, creating a cycle where worrying about sexual performance only makes things worse. That's why it's so important to be well informed about all aspects of your health, including the effects that medications can have on your sex life. And that's exactly what we're going to talk about in this video. How to identify these medications, understand their effects, and most importantly, what you can do to prevent them from harming your erection. When we talk about men's health, we usually think about diet, exercise, and regular checkups. And of course, these things are super important for keeping your body healthy. But sexual health, especially the ability to get and keep an erection, also needs to be a priority. Erection is not just a matter of pleasure. It is also a sign that the body is functioning well. Erection problems can be a warning of more serious conditions, such as heart disease or diabetes. What about when the reason for erectile dysfunction is a medication you take to treat something else? Something you would never suspect. Many men don't make this connection and end up suffering in silence, without knowing that the solution may lie in the medicine they are using. Furthermore, it is important to remember that side effects may vary from person to person. One medicine may not cause any problems for one man, but for another it can be devastating. Factors such as age, general health, and other medications you may be taking can influence how your body reacts. Therefore, it is essential to talk openly with your doctor about all the medications you are taking and how they are affecting your sex life. There's no need to be ashamed to talk about it. After all, your sexual health is an important part of your overall health. In this video, we will talk simply and directly about the medications that most cause erection problems and how to deal with them in a practical way. Whether it's adjusting your dosage, changing your medication, or adopting other strategies to protect your erection, information is the first step to regaining your confidence and sexual health. First, it's important to understand how erections work. Think of it as a show where various parts of the body need to work in harmony so that everything goes as expected. The brain sends the command, the nerves transmit the message, the blood vessels dilate, and blood flows to the penis, resulting in an erection. This is a natural and crucial process for a healthy sex life. But just like any show, if something gets out of hand, the end result won't be what you expected. Now, imagine that you start taking medication to treat something like high blood pressure or anxiety. These medications are essential for your overall health, but they can interfere with this delicate process. Some medications can reduce blood flow to the penis or disrupt the signals that the brain sends to the nerves, making an erection difficult or even impossible. The worst thing is that you often don't even realize that the medication is to blame until the problem has already appeared. For example, medicine for high blood pressure is essential to prevent serious problems such as a heart attack or stroke. However, some of these medications can impair the body's ability to maintain an erection because they relax blood vessels, which decreases pressure. This is great for your heart, but it can be bad for sexual performance. Likewise, medications used to treat anxiety or depression and alter the levels of neurotransmitters in the brain, which are essential for sexual desire and erections. Another group of medications that can affect erections are antihistamines, used to combat allergies. They are great for relieving an itchy or stuffy nose, but some can reduce sexual desire and make it difficult to get an erection. Additionally, insomnia medications can also have an impact as they slow down the entire nervous system, including the areas responsible for sexual arousal. But calm down. I'm not saying you should suddenly stop taking your medication. That would be very dangerous. The important thing is that you are aware of these possible effects and speak to your doctor. There are often options that can treat the health problem without harming your sex life. For example, there are medications for high blood pressure that have less impact on erections, or treatments for anxiety that do not interfere with sexual desire. It's all about finding a balance between your overall health and your sexual health. The most important thing is that you do not remain silent about this issue. Many people feel embarrassed to talk about erection difficulty, but it is an essential part of men's health. If you are experiencing problems, whether due to medications or any other reason, talk to your doctor. He is there to help without judgment. Remember that a healthy sex life is an important part of your overall health. For anyone who wants to improve sexual potency, increase desire, or understand how to avoid these side effects, this video will be very useful. We will cover not only the medications that may be harming your erection, but also discuss treatment options for erectile dysfunction and impotence, as well as offering important tips in urology and andrology. We want you to have all the information you need to make informed decisions about your health. Don't let these medications affect your erection without you knowing what's happening. Explore other videos on our channel about men's health, and above all, take care of your health in all aspects. Your sexual health is as important as any other part of your body. Remember, you deserve to live fully without compromising your sexual health. Be careful with the medications you use. Always talk to your doctor, and know that there are solutions to maintain a healthy sex life, even in the face of challenges. Also check out our playlist, where we discuss several important topics for your health. Leave your like, share this video with your friends. And don't forget to subscribe to our channel to receive valuable content about men's health and urology. Thanks for watching, and see you next time.